right. Great. So let's get started because we've got a lot of wonderful things to discuss today. My name is Molly Hastings, and I am the statewide training manager for the Brain Injury Association of North Carolina. And you all have made it to the BIONC webinar series. So while you're introducing yourself and getting comfortable, I just wanted to go over a couple things today that the Brain Injury Association has going on. We have a conference coming up April 13th and 14th for 2026. It's going to be in Wrightsville Beach this year again. We're really looking forward to it. Our two speakers today will be presenting at the conference as well. And so this will be a little taste of what you can get for the whole conference. And you can sign up right on our website. Sign up is still to register. It's still open. It's also Brain Injury Awareness Month. We have here at the Brain Injury Association of North Carolina, we have so much going on. We have a calendar that I will put in the chat a little later on that has everything that our outreach team is doing in the community. We have public things that you can register for. We have virtual things. We have a couple more webinars, 2 coming up in March. And yeah, so there's a lot going on. So feel free to check that out. And you can look, we have registration links down at the bottom of the page if you do have to register, and just a lot of information. And so we also have a gaps and needs survey that will be coming out soon in March. That is going to be for survivors, caregivers, professionals, and providers. It's a different survey than we've done in the past. And so we're really looking forward to that. So we're hoping that anyone on this webinar today, just keep an eye out for that. And we would love to have your input on those gaps and needs in North Carolina. And a great way to stay connected is through our monthly newsletter. So if you go to our website and scroll down, you can sign up for our newsletter. It comes out monthly. It has everything that we're doing, out in the community. It will have, the gaps and needs survey, updates on the conference, and also updates on when camp is going to be this year. And so that's definitely just a great way to stay connected. And a couple of just Zoom reminders and housekeeping. The webinar is being recorded, and we'll be sharing the recording on our YouTube channel, which is right there. And so if you something happens and you would like to reference it back, we will upload that within, a week. Usually takes about a week to get up. And all attendees are muted to just minimize that background noise. But if you do have questions during the presentation, feel free to put them in the Q&A box, or you can put them in the chat. And then we will address them at the end of the presentation. If you have a question and it's not answered, do not worry. We will answer your question and then send the answer via email. And once the webinar has ended, just a short survey will pop up on your screen. After you fill out that survey, a certificate of attendance will just be sent right to your email address that you provide on the survey. And then it will also be sent in the thank you letter through Zoom, another link to that survey as well. And lastly, just sit back and enjoy this presentation. Today we have Lynn. Oh no, I just forgot. Lynn, how do you say your last name one more time?
McCord. It's McCord.
I did not get that. Yes, Lynn McCord. She is currently the consultant for the psychological services and coordinator of the TBI training within the Office of Exceptional Children at the North Carolina Department of Public Instruction. And as a licensed school psychologist, Lynn spent the first 15 years of her career practicing and later co-leading a department through innovations and expansion of the role of school psychologists within the fastest growing school systems in North Carolina. Within her current role, Lynn's efforts have targeted on supporting practice that advances equitable evaluation and identification practices for students with special needs, most specifically autism spectrum disorder, intellectual disabilities, and specific learning disabilities and traumatic brain injury. Lynn also oversees the coordination of and management of the NCDPI's registry of approved providers for TBI, consisting of approximately 25% of school psychology workforce who have received specialized trainings in conducting IDEA evaluations for TBI consideration. And we also have Ashley Taylor Layton, who is a school psychologist and has supported the work for students with traumatic brain injuries since 2008. She completed her undergraduate degree at the Utah State University and her graduate degree in school psychology at the University of North Carolina, Chapel Hill. She worked in Wake County public school system for 13 years before moving to an independent consultant role while she raises two inquisitive learners of her own. Ashley currently helps support all things TBI, from online curriculum to supervision and management of the registry to planning the annual TBI Institute for NCDPI approved providers. She also works with the NC School Psychology Association, the NCSPA, as the membership and event manager. And today that we'll be discussing, the North Carolina Public Instructions, the NCDPI expanded definition of TBI. And that really has important implications for how students are identified and supported in the public schools. So this session is going to highlight the key changes and discuss the impact on evaluation and eligibility, and offer practical guidance for translating the definition into effective school-based practices. All right, without further ado, Lynn and Ashley, you can take over.
Thank you so much for that warm welcome, Molly. I'll let Ashley go ahead and get us started because she leads me often.
All right, we'll see if we can get our sharing going.
Should be good to go.
There we go.
Excellent.
Thank you.
Well, thank you, Molly. We really appreciate the opportunity to be here today. Lynn and I have both been involved with TBI work, for several years now, and it's kind of a treasure that we have, that we really enjoy working with students with brain injuries and the psychologists and other service providers who also work with them. So our objective today was to really focus on the expanded definition that the Department of Public Instruction uses, and kind of the implications of how students are identified and supported in the public schools. So this session is going to highlight those key changes, kind of look at the impact of the evaluation and eligibility process, and then offer, hopefully, some practical guidance for translating that definition into effective school practices. Molly did a great job of introducing us already, so we'll just skip right on over onto this one. So our objectives for today are these three things. We really want to look at the evaluation requirements for TBI identification. You might be familiar with how eligibility works for special education works in public schools, and you might not be. So we're just going to give you a little bit of an overview, especially as it's related to brain injury. The other thing we're going to do is we're going to look at the definition of TBI as in our communities as right now, and then the expanded definition that occurred back in 2013, and then look at how that has impacted it. And then third, we're going to consider the future planning and the potential next steps. What can we do to move forward to really support the brain injury population across our groups in North Carolina? So that's what we're going to be doing. And Lynn's going to start us off by looking at those eligibility requirements within DPI.
Thank you, Ashley, and welcome everyone. This has been a historic kind of I think we're about 13 years into the definition change, but we haven't talked about it in a little while. So we wanted to share with the community that piece of it. But before we get started, I'd like to cover some of the components that we want to address in Objective 1 as we consider our North Carolina Public Schools Office of Exceptional Children, so lots of acronyms in there, which is the Special Ed Office at DPI, and their evaluation requirements. There's three different aspects for special ed eligibility for most disability areas. TBI is one where we identify a disability that exists, but then we also conclude through the evaluation that we conduct whether there's an adverse effect on a student's educational performance in their setting, their educational setting, and whether or not that adverse effect drives a need for specially designed instruction as it's defined in the IDEA. So I'm just going to hit on that and give like a quick overview as it relates to traumatic brain injury in our public schools. The eval requirements start with the written, for traumatic brain injury, a medical verification of the injury. So we have to have something that comes, public schools do not employ licensed physicians or neuropsychologists. So we rely on external sources for that documentation of the event or the brain injury that's occurred. There is no expiration date on whether and how a public school entity receives that medical verification. It could be something that happened at birth with the student that we now have and just learned about as a seventh grader. And often our providers spend a lot of time tracking down once they get knowledge of these events that have occurred in a child's history. So we really try to be more proactive about it so that we don't have to spend a lot of time searching for the medical verification and tracking all of those records down. However, we know that that doesn't always happen. We've tried to approach it from a proactive standpoint, but regardless of when the verification occurred, we accept it, and school teams should be accepting it because there are no time limits for that. So that's kind of the big piece of it. Sometimes we receive it and then we go forward. Sometimes we hear about it from a parent in a meeting and or somewhere in some documentation process that's occurred, and then the light bulbs go off. We consider that we need to investigate TBI, and then there's a lot of backtracking in the student's history. So that's one piece. The next components, what I'll talk about is very North Carolina specific. IDEA, our Individuals with Disabilities Education legislation, which hasn't been reauthorized since 2004. So it's really we're a good few couple decades into the IDEA. But what IDEA gives the states is our definitions. They give definitions for the disability areas. The federal definition for traumatic brain injury is very similar to what many states utilize. And when we think about external events that occur and result in injury to the brain. So that's what we get from the IDEA. And then as a state, for every disability area, we then determine how we go about investigating in alignment with how those definitions. North Carolina is very specific in what they prescribe for the evaluation requirements for every one of the 14 IDEA disability areas. So on this slide and the next, I'll just kind of share with you. And we will share these slides, and there is a direct link to our North Carolina policy manual where you can access through the policy manual the required screenings and evaluations for traumatic brain injury. You can see them. I mean, like a hearing, vision screen, speech language screen. There is an intervention requirement that typically, depending on the severity of the brain injury, we often get from rehab and inpatient or rehabilitative services, like we are not to be putting kids through hoops and like meeting an intervention requirement for this. Those often suffice, and often A, B, C, and D are met um, through a hospitalization or other type of rehabilitative setting that might occur with a student. However, we do have students with mild traumatic brain injuries like concussions and recurrent re-injuring, and there are interventions that should be matched to support that student's needs within the context of their general education curriculum. And we want to be able to document and measure and determine how effective those things are as well. So there's there's a broad range of injury that could occur, and we don't want to discount what we should be doing for those with mild traumatic brain injuries as well. So those are the first kind of like slew of requirements. And they keep going. North Carolina is very prescriptive, and the teams must actually make sure that they are gathering these pieces of information as part of the evaluation. And like I said, we're very prescriptive historically for all disability areas. So we're just seeing the TBI requirements right now. Of course, we want to be able to review medical history and record, and that's where we would be documenting, right, the medical verification and any other follow-up information that we have. We want to make sure that we have a good understanding of the child's educational history. It's really important for TBI, particularly if the brain injury occurred, while the student, along the educational trajectory of the student, because we would have really good pre-event versus post-event information about that student's functioning. So the history is always important, but when we have a student who experiences a brain injury along their educational career, we have really good information about pre-injury functioning as well. We always should be engaging. These are the summary of conferences with parents and documentations of attempts to conference with parents are a requirement for all 14 of our areas, as well as the review of the educational history and records, in addition to the social developmental history. The things that we collect, in each of depending on what area you're investigating, vary within the social developmental history. You can imagine what we would be really wanting to glean from that parent's input of the child's overall social and developmental history when we are talking about brain injury, depending on the type of injury. So there's very specific targeted questions that we can shape into that developmental history data collection. This is a lot of reliance, as you can see, on external sources of information that we utilize, or that the IEP teams should be utilizing to gather and curate and put together a picture of this child that we're considering for traumatic brain injury eligibility. We do also observe across settings and, of course, do some targeted educational evaluation and certainly collect some updated educational evaluation information, particularly if we have pre-existing information, which we should, in the schools around how the student was functioning academically. And then there's a psychological evaluation that's a requirement, as well as a motor evaluation. Trying to think if there's anything more specific I want to say about that one, Ashley.
I'll just add that sometimes, while not a required component, these are the required screenings and evaluations. But depending on the needs of the student, an evaluation team may also look at adaptive behavior and or emotional, like behavioral functioning, or specific assessments in those two categories. And so they're not required components, but they are often utilized within an evaluation team, just depending on the needs of the student.
Yeah, thank you for mentioning that and reminding me that something I wanted to say as we get into the next slide that's specific for the psychological evaluation requirements. Sometimes our definition of psychological evaluation and the policy manual actually is pretty robust. and it always must include a cognitive evaluation, but it also may include things like what Ashley referenced, some very structured observations of the student across different settings, as well as adaptive behavior, um, assessments, not just the standardized assessment tools, but also things that we collect in through our structured observations or interviews with those that interact with the child on a regular basis, and the behavioral emotional kinds of assessments. They're all actually included in the psych eval definition. However, sometimes, um, people kind of glaze over that part of it, but you can utilize your psych eval for those purposes. Sometimes it's just an external piece that's also pulled in to the evaluation. For instance, I'm trying to think now, what additional types of information might be collected, because TBI covers a lot of providers, actually. We have our speech language pathologists involved. We already have our psychologists involved. We have some level of, whether it's an occupational therapist or a physical therapist or both involved. So there is a pretty robust group of people that are already involved in the evaluation. But what you can consider that A through L is pretty much the minimum standard. So it's like what everybody, the threshold every team has to meet. But IDEA also is very good about reminding us that we must assess based on the unique needs of the child. So if there's additional areas that need to be investigated that might require other provider types, we would, of course, include that. So it's minimum set standard, but can always be additional outside of the A through L. And the psych evaluation requirements for TBI even get more prescriptive. So in North Carolina, this is very unique to the state of North Carolina. I haven't found another state yet that is doing this. So all of you that are going to the national conventions, please ask these questions and find out if there's any other states that are doing anything really additional, like we've been doing in the state of North Carolina for, I guess, at least 30 some years now. So the school psychologists that are involved in the if they're involved in the evaluation, you can jump down to the third bullet. They must meet an additional layer of training that DPI offers. As Molly referenced, part of my role is to oversee the registry of TBI trained school psychologists or TBI approved providers. And so any psychologist involved in the psych eval for students in our public schools for TBI consideration has to have been through that training. Of course, neuropsychologists already meet it. So we just reference that if we receive an outside neuropsychological evaluation, then of course, right, we're good. Most of the time we may have to do some additional components, but that's not the requirement is very specific to school psychologists who are just licensed as generalist school psychologists practicing school psychology. There is this additional training that the North Carolina Department of Public Instruction Office of Exceptional Children has required for many, many years. I met it when I got here. It was already at least 15 years in existence. And so we just continue it and try to make it better and more efficient and more accessible to all of our providers across the state, all of our psychologists across the state. And we do have a requirement to have those evaluations to be actually current within a year, because we certainly want information that's recent to be able to, things change with brain injury and with development, with cognitive functioning. So we definitely don't want to be using old information to make current decisions. So that's why that current within a year is in there as part of the policy. So all of those things would lead us to affirming a traumatic brain injury. And then that is, as North Carolina defines it, we're going to get to that because we do exceed the IDEA requirements here in the state of North Carolina in how we define TBI. But I'll get you through these last two steps before Ashley goes into talking about our definition. So we do the evaluation, we get to traumatic brain injury, meets the threshold, right? It's kind of, we're really assessing when we have documentation of the event and an injury, we're really assessing to really look at what the level of impact is and a need for specially designed instruction. TBI is one of the disability categories that once we already have verification that it's there, that it happened, we're not really doing heavy investigating to affirm whether we have a brain injury. We're actually doing the investigation and the evaluation, more importantly, for these parts of eligibility, which is what's the level of impact on the student's educational functioning. And we list there on that slide things that could be impacted, because it's not just about how they can perform on an academic assessment. It could be how they're engaging and performing their daily living skills, or what's happened maybe to their executive functioning and their organization and planning skills. How are they able to function socially? Is it effective or not? Are they able to regulate their emotions, or are their emotions dysregulated? So these are the types of things that all are included in a child's educational performance when we're looking at IDEA and special education services. So we assess really a lot around TBI to look at measuring and quantifying what's the level of impact. And then once we get there and have information around whether or not there's an adverse effect as a result of the TBI, then we look at whether or not the student requires specially designed instruction as it's defined in the IDEA. And that's what you see on the screen is really IDEA's definition, so that you'll have it and you can, I don't need to read it to you, but you can see how it's specially designed instruction has some key kind of characteristics in how it's defined, has to do with potential adaptations to how we are structuring content for a student, how we're the methodologies that we use to deliver instruction to a student, and we may even be making some significant adaptations. And if those are things that the level of impact is driving, then we can kind of we can determine whether or not they meet the definition of specially designed instruction, and that then moves us into designing instruction around specially designed needs, special education needs that would come through an individual education program or an IEP. And that, in a nutshell, is North Carolina's evaluation kind of like steps through the process, and particularly for, obviously, here we are today talking about traumatic brain injury.
Yes, so now we're going to reverse just a little bit, right? So we talked about when a student has a brain injury, we evaluate to understand the impact and then design specially designed instruction for that if necessary. So what is that definition? And how is it different than IDEA and other definitions that you might be familiar with? All right, so these are icons that you are probably familiar with, and I'm just going to quickly go over their definitions, right? So the Brain Injury Association of America actually has 3 definitions on their website, right? It talks about traumatic brain injury, which when brain function is altered by an external force. So just keep that in mind. And then it differentiates concussion or mild traumatic brain injury. And then the third definition they have is a non-traumatic brain injury, which causes damage to the brain as a result of internal factors. Okay, so you do have those differentiation there.
Mm-hmm.
Now, the National Institutes of Health also has a definition here. And again, it's more about the external force, a brain injury that is caused by an outside force. The North Carolina Department of Health and Human Services defines a brain injury as an injury to the brain that is caused by an external physical force. You're seeing the similarities here, right? And then in the United States Department of Education, or IDEA, defines TBI as an acquired injury to the brain caused by an external physical force. So all four of these entities define a brain injury as something that an injury to the brain because of an external force. Now, the North Carolina Department of Public Instruction, here is their definition. And you can tell just by the length of it that it is more than just an external force. That is part of it, but it is caused by an external physical force or by an internal occurrence. And then it, talks about the different impairments and that adversely affects a child's educational performance. So it combines both the traditional definition of TBI as well as the acquired brain injury, or what the Brain Injury Association of America would call a non-traumatic brain injury. So it's all of those. Now I'm going to break this down just a little bit because this is a lot of words on one slide. So let's look at this a little bit more. I'm actually going to do this one. Okay. So the sub areas that this expanded definition includes. We have our open and closed head injuries, which is your traditional definition of TBI, but can also include cerebral vascular accidents. So that's your strokes, your intraventricular hemorrhages for newborns. It could be caused by infections or kidney or heart failure, electric shock. I've luckily never had to assist a student with electric shock, but it's in there. If they have a brain injury from that, they could receive services. Anoxia, tumors, metabolic disorders, toxic substances, including lead poisoning, medical or surgical treatments, including like chemotherapy or brain surgery. So it just opens a huge door to be able to provide services and support for students that have either a closed head injury or an acquired brain injury. Now, the definition does differentiate that it doesn't include disorders that are congenital or degenerative. So an example of a congenital disorder would be like a Chiari malformation. That they were born with that, things like that. Degenerative would be like I'm thinking like Parkinson's, right? Kids are not going to be diagnosed with Parkinson's, but it's a degenerative disorder, neurologic disorder. It also can include birth trauma. So if the cord was wrapped around the neck and caused an anoxic event or a hypoxic event, that would be considered as part of that definition and the broadening of it. So that may have opened a lot of questions. Go ahead and use the Q&A if you need to, or the chat. Feel free to drop your questions in about this expanded definition. But what I'm going to do is I'm going to move on to kind of looking at the impact of this expanded definition and what it has led to in the public school system. All right.
Yeah, and as just a quick reminder, we've been tracking, as Ashley will show you, obviously on this slide, since I think it was October of 2013. So this is over 12 years in, right, to the definition change. Because before October 2013, it was what you all heard from Ashley and our IDEA. It was very much aligned with IDEA, traumatic brain injury definition, until there was some work done that moved to this broader, all-encompassing brain injury from the perspective of all brain injuries are traumatic, right? So
Yes.
really opening up that and many other types of events that can occur that result in brain injury for consideration of our children 3 through 21 in our public schools.
Yes. All right. Okay. So this expanded definition, I think the biggest impact that we've seen in the last 13 years um, has been an increase of 154% of students eligible for services in the area of TBI. So the last publicly available count of students with special education was from the April 2024 um, child count, is what they call it. And so in December 2013, there were 439 students in North Carolina identified as a student with a TBI. And then in April 2024, there were 1,228. That is a massive increase just in the 13 years. Um, and just to put this in a little bit of perspective, I maybe should have added this as a trend line so you could see it. But specific learning disability, that's the most prevalent of the 14 areas of disability within the Department of Public Instruction. And it has seen a decrease of 4% in the same time period. So you can, and actually the only other area of eligibility that has seen an increase in the same time period is the area of autism. Every other category has decreased, which I think is a testament to DPI's work with special education and our return to or our response to intervention, or the multi-tiered systems of support. I'm throwing out all these words, but you can always look for them within your own school districts pages, websites. But we're really focusing on providing interventions before special education's even needed. And so you see that decrease, generally speaking. But with TBI, we see an increase of 154%. I don't
Which
think
is
that means we're having more brain injuries. I think it's a general awareness of brain injury. But then also, this expanded definition allows us to provide very specific, targeted identification of students who before would maybe had gone into other categories of eligibility based on their need, or simply just not even qualified for special education services.
mm-hmm. Yeah. Yeah, I think that that's the most pronounced. It's doing what we intend it to do. I certainly believe we're still under identifying, um, or maybe still misclassifying some things as like other health impairment or maybe multiple
Mhm.
disabilities, other areas, and it doesn't always mean a whole lot if we're serving the student properly, but knowing, I think, and identifying and having it in the student record appropriately classified as a traumatic brain injury instead of other areas is really, I think it's really important to be able to call it what it is and understand how to support and address and connect to services all along the way, even out in the community. So we're seeing, that it's doing what I think the intent was behind the advocacy effort, but still a long way, to go with identifying students in that category. Yeah, I'm sure there's a lot more out there, in other words. But we're
Yes,
getting there. We're moving in the right direction.
we are.
Mhm.
Yes. One of the questions that came into the Q&A was, since the definition has expanded, has the state expanded brain injury services per county, or is that left up to the school districts themselves? And that is a very good question. And right now, you are looking at NCDPI's TBI support.
And
It's us.
I want to add this. I want to add this because this is really connected to federal funding.
Yes.
I actually get contacts, and I just had one from another state who's really exploring this expanded definition out in the northwest area of the country for her state. And so one of the first questions she asked me when she did outreach to talk about how we approach this and how it's going is, how did you secure additional funding for this federally? And I'm like, we didn't, because we did choose the North Carolina, the federal definition is the federal definition. And then state funds are state funds that are allocated by, the way that they're allocated. So there is no additional funding. But despite the lack of additional funding, we still want to do the work that we believe is appropriate for the students in terms of calling it what North Carolina has embraced as: every brain injury is traumatic, and this is where we need to focus our energy on. So that's kind of the charge that we take up. And public education, as we know, is still significantly under resourced. But it's interesting when I hear from other states and they ask me, with the definition change, how did you go about securing additional federal dollars? And I'm like, there's no additional federal dollars.
Nope.
So, yeah.
But I think our state has really emphasized this training, and this actually will show,
Yes.
the state is putting forth the funds to help support this to a certain extent, right?
Yes. Yeah. Our office has really supported this additional training for the providers, for sure. Yep.
Yeah. So Lynn talked about that additional layer of training that school psychologists need to work with students who have had brain injuries. And there are several school psychologists and a few occasionally private practice psychologists who have completed this training to qualify as an approved provider for TBI evaluations. So the expanded definition did lead to a need for an increased number of these approved providers. So just to give you some reference, there are about 800 school psychologists serving North Carolina public schools right now. Which is not enough, by the way. The recommended ratio is 1 psychologist per 500 students. North Carolina's current ratio is 1 psychologist to about 1,900 students. So you can see we need a lot more school psychologists to support our students. But again, North Carolina is unique in requiring that additional level of training for the evaluation of students with brain injuries. So when Lynn started as the DPI consultant back in 2014, there were 169 trained school psychologists, or those approved providers. And through the work of the school-based practice committee and the support of North Carolina DPI, and some neuropsychologists across the state who have agreed to partner with us, we have improved those training efforts. We've really streamlined them, made them accessible to any school psychologist in the state, and the number of approved providers has increased to 221 currently, which is about 27% of the workforce. And then we have over 30 more in the training process this academic year. So we should be able, by the end of June, our academic year, we should have 252 approved providers throughout the state to be able to support students. And it is important to note that, providers come off of the registry as they retire and decide that they don't want to do evaluations anymore or keep up their license, things like that. And then newly trained psychologists are added to the registry each year. So it kind of balances out, but we are starting to have a more profitable, for lack of a better word, a higher return on the training than people coming off.
That's true. And we definitely are, the leaders in our office are invested in Ashley's worked so well with me over the past handful of years to improve efficiency and access and remove barriers to access for providers, psychologists across the state. And we're getting better at it, but we're still looking to even make the process more efficient. And I know my leaders in our office are really trying to like have a goal of like, we would love every psychologist in the state to have received this training. So that's a bit of the charge that, I've been given. And so we've got a ways to go with that because it does take time and we don't want to diminish quality to just cycle people through. So we're working on creative solutions for that as we look into next year. So I'm excited to see that right bar continue to go up into next
Exactly.
year. Yeah.
And I was thinking we should have linked it in here, but maybe Lynn, you can drop it in the chat. Like, how do you find these approved providers?
Yeah.
And we do have a
Mhm.
public facing
Yeah.
database of these approved providers. And so you can look at, for them in the county that you're working with. If you're working with a client who has a brain injury and needs some school-based support, you can reach out to those approved providers to help get you in touch and start the process of the
Yeah,
school-based
that was
work.
a great idea. And we'll link it in the slide before we share the slides. We'll link it
Exactly.
on this one, but it's in the chat now for you all.
Well, and now numbers are all fine and good, but we also want to really look at the impact that we've had on students. Um, and the school-based practice. So this expanded view does support identifying students whose brain injuries might not be captured under that stricter, more traditional definition. So this expanded definition has really led to better identification and services. Some of the examples that we thought of that we really wanted to highlight today were the multidisciplinary evaluation processes and teams. And it's yes, we have to document how the brain injury impacts educational performance, but we have the ability to work with speech language pathologists, occupational therapists, physical therapists, school nurses, vision impaired teachers, anybody that the student might need to provide a really good working picture of how the student is functioning, not just academically, but with their peers, within their community, within their school setting, and really being able to provide and set that student up for success so that they can continue to access and participate and make progress in the general education setting. Um, the other thing that I feel like the expanded definition has really led to is just an increased professional learning and awareness. I think our first, Molly alluded to the TBI Institute during our introductions, and I think we started out with regional events for school psychologists specifically about how to work with students with brain injuries and how to evaluate and how to work with teams and all of that. Now this TBI Institute is now an annual event. It's statewide, and it includes all other service providers. And we talk about kind of all things TBI. And it's really an opportunity to share about pediatric brain injury, whether it's traumatic or acquired, and what it might look like in the schools and how we support it.
Mhm.
Along with that, we have quarterly practice briefs that go out to school psychologists specifically. And we have communities of practice that they can access, like kind of like a listserv of other professionals that they can really network with and kind of consult with as cases come up and they need it.
Mhm.
The other thing too that I think has really come because of this, along with those professional learning opportunities, is the school psychologists who are on this approved provider registry do have to participate in enough professional learning within every 5 years, kind of saying the same as their like educational license. They have to participate in continuing ed um, activities to show that they're can staying up with the TBI research and practices. So it's not that you have somebody who was on this approved provider list 30 years ago and has never like talked about TBI ever since, but that we really want to make sure that the professionals who are working with students with brain injuries have good research, good practice-based strategies that can really impact the students' performance in schools. Kind of related to this expansion, we expanded the definition for eligibility, and then we said, wait, we need to expand Gefeller-Waller. Not that we did, but Gefeller-Waller, if you're familiar with that Concussion Awareness Act, really focuses on student athletes. But we realized that there are many students who are not necessarily student athletes who are also facing the impact of concussions. So we expanded our work within the return to learn and return to play policies and worked to get a return to learn policy for all students. Part of that is that policy, and it's a state board of education policy, is that there's an annual training for all educators. DPI has also worked to create a training that's available for the team of professionals who are developing the return to learn plans either in their district or in their schools, and it walks them through. We have an implementation guide. They've really supported not only expanding that definition or that net for mild concussion, but then also the resources to support educators who are working in that area. And then the eligibility criteria from our medical providers and the functional school data, the teams really are better able to get the interventions that the student needs. So for some examples, I have done support groups with students with mild concussion or mild TBI. Some might have special education, some may not. But they have an opportunity to be supported as they kind of deal with the concussion and the outcome of that. I've seen an increase in executive functioning interventions, whether it be in IEPs or 504s or and things like that. The adaptive behavior interventions that we can come up with because we're working in multidisciplinary evaluation teams has increased and been far more productive. And then a kind of along with those concussion things, our return to learn protocols have increased as well. So those are kind of some of the practical school-based practices that we've seen improvement since that expanded definition.
Mhm.
So again, I'm seeing some questions come in. We say okay,
Yeah,
yeah,
we're about 6 minutes
question,
too.
Matthew.
I know we're
Yes, we
running
are
low on
running.
time.
I know. Lynn and I are talkers, so.
Well,
Okay, so let's talk about our future. What are we going to do with this information?
yeah, so this is where we want to kind of leave some food for thought and offer even ourselves as thought partners beyond this webinar, really. Because as we said earlier, we're 13, I guess, maybe I'll say 12, but more like we're approaching 13 years into the expanded definition. And what, you know, it has come up in some of the networks that I have access to, a state level change so that we can all, one of the biggest things that we become concerned about with students who are under our umbrella of traumatic brain injury and accessing services that are connected specifically to their brain injury, when they leave our public school system, they may not continue to meet that definition, right? And so that is always a concern, and it's always in the forefront of my mind in terms of gaps that may occur externally or even as they're in school and community-based service gaps. So we really wanted to leave some kind of thought points. If we had more time, we would want to engage with you all. So maybe this would be like a future session somewhere when we're in person. That we really think about what are considerations that you may have in thinking about what these benefit how these 5 bullet points around benefits may be able to be more supportive and more comprehensive in how our state as a collective whole thinks about our entire brain injury community, and is operating under common language in how we define it. And I know I don't want to spend a whole lot of time through the notes, but when you think about the service gaps, when you think about being able to recognize chronic conditions and have a more comprehensive care model, being able to improve our community, all populations across our brain injury communities, access to care, and being able to have more comprehensive model of care for this population. It seems like it's worth, and it has been thought about, I know, within different networks and parts of the community of brain injury. So we know that we're probably talking to a lot of folks who are not maybe serving within our public schools, and you are those access points to the larger, broader brain injury community in the state of North Carolina. So how could this be something to consider? And we've had a lot of, again, I get contacts from different parts of the country around state education folks really looking at expanding their definition. I'm not aware, and maybe you all are, of other states in our country that have in fact expanded the definition, because the definition for TBI is still the external force resulting in impact to the brain, and then we kind of talk about brain injury in the bigger picture and all brain injury, but we just like to operate under that. All brain injury is traumatic when it occurs, regardless of how it occurs. And so, like, let's talk about it in that sense, and let's use that IDEA category to actually identify that injury in a way that makes the most sense for that student. So we just would love for consideration of where's your sphere of influence? Is what access do you have to legislative networks through our North Carolina General Assembly? I know that we have the Brain Injury Advisory Council. That's a legislatively mandated council that's supported through the North Carolina Department of Health and Human Services TBI arm and team. And we have our lovely, here we are today with the Brain Injury Association of North Carolina. So just in consideration of those networks, have some thought about it. And Ashley and I are always happy to be thought partners in our experiences in working through this, because we've worked through it. We continue to work through it with, again, funding that is not, that's, there's no additional funding that comes with it. But thinking about what would be some potential next steps, who might want to be involved in it, and how would an effort move forward. And so, of course, we leave you with our contact information as we've run out of time today.
Oh, wow. My goodness. Thank you so much. That was such a great presentation and so informative. And I have so many questions, and I'll follow up with you guys. And if you as well out there in the webinar world, if you have questions for them, feel free to reach out to them directly. You could also put that into our survey at the end. There's a little box that you can fill in if you have a question, or of course, reach out to me, mhastings@bianc.net. But thank you so much for your time. Check out our other webinars and things going on. And happy Brain Injury Awareness Month.
Thank you. Happy Brain
Thank
Injury
you all.
Awareness Month to you all. And if there are
Thank you,
questions,
Ashley and Lynn.
yeah, if there are questions that come in and are captured, we're happy to put together just a companion document that goes with this information and for posting, if that would be helpful.
So great. Yeah.
Thank you all.
Thank you. Have a great day,
Bye.
everyone.
Thanks.